Hi, good
Hi.
evening.
Hi, good evening.
So, welcome to Narikotha next episode. A lot of people have asked me that you run a IVF clinic, a fertility clinic, and where most of my patients are suffering from infertility, and they come to me because they are desirous of having a baby. Then, why am I talking of topics like contraception and breastfeeding? Now, my answer to this is I always very proudly declare that my clinic, Urvara IVF, is not a IVF or a fertility clinic. It is a women's clinic. It's a clinic run by women for women, and here all the staff, they are women, and we treat each and every patient in a very boutique model and with a lot of compassion and kindness. It's a very, very affordable clinic, and here we not only do fertility issues, but we also do maternity, delivery, laparoscopy, hysteroscopy, contraceptive issues, and I personally do not do have stopped doing abortion these days, though it's completely legal in our country under the MTP Act of 1971, where a woman can opt for an abortion. But somehow I feel that it's too much of a yo-yo for me, that going in for a IVF in one patient and an abortion in the other patient. So on a personal level, I've stopped doing MTPs, but that does not mean that I will not see the patients who are desirous of whatever issues they have in the field of gynecology. So today is a very interesting episode, and with me I have a very sweet young lady. Her mother is a dear friend of mine, and she's Miss Ankita Malik, and she's a lactation educator, which means that she knows everything about breastfeeding. Now I'm going to pass it over to Ankita, and she will explain about her training and what she's learned. Ankita, please tell about yourself.
Hi, everyone. I completed my training in breastfeeding education from this organization called CAPA, which is a US-based organization, and it trains people, it trains women in post and prenatal care.
Okay. And what does CAPA stand for?
You'll have to just Google on the
Okay.
website. And
All right. So that's like it's very specific that they teach you everything to do with breastfeeding.
Yes.
Now, this is really going to be very, very interesting because for every new mother, breastfeeding is a very important issue. And would you like to say a few, I would say, a poetic lines about breast milk? I think that would make the talk very interesting.
So breast milk is literally, it's regarded as liquid gold. It is extremely beneficial to children, to newborns, to babies, and it is literally for every baby. It is manufactured specifically by the mother, which is it's designed in a manner to suit only her baby's needs. So if a mother can breastfeed, I don't just call breastfeeding a nutritional need, but I consider it a relationship. It not only is a nutritional relationship, it's also an emotional, and it's a very, very special kind of relationship between a mother and a child, which every mother should ideally enjoy. Unfortunately, in India, there is a lack of awareness because breastfeeding is such a complex subject that a lot of times women need guidance. But in India, we don't have enough. And when I had my own baby, that's when I decided that I want to kind of propagate this subject and I want to take this forward and I want to help all those women who are too shy or who are too uncomfortable or who have gone through some issues during breastfeeding and lactation.
Fantastic. As I was listening to you, a word came into my mind, and the word is nature's nectar.
Absolutely.
So, how is it if we consider breast milk as a nature's nectar? So, and breast milk is there across all mammals. Mammals are called mammals because they have mammary glands. Right. And through these mammary glands, breast milk comes automatically. When the female of the species has a baby, reproduces, then the nature's nectar comes automatically to the mammary glands. And it's very, very species specific, and the mother's milk is for the baby. Something, out of uh, our discussion today, I would like to, you yourself mentioned that when you had a baby, you had this feeling in you that this is so important and you're going to help other women who really need your help. So do you think that having a baby has made you a better lactational educator?
Definitely, because I feel I can connect.
So now this is Narikotha, women are talking, and please feel free to ask your questions. Please come online, share this, because this is really going to be very, very helpful. Yeah, Ankita.
So I definitely feel the reason I got into lactation education is because of what I went through when I had my baby. The doubts and the issues which I had was something which didn't even cross my mind before I conceived. So that's the reason why, of course, motherhood taught me so much, and that's what got me involved into lactation.
Yeah, even I would like to share a piece or two. I finished my MD in obstetrics and gynecology before I got married. And after I got married and I went through, because we had read everything about pregnancy and what can go wrong and what is normal, etc., etc. But when I really went through my own pregnancy and had my delivery, had a cesarean, had a boy, I became a mother. And somehow I felt that it made me a better doctor, because I had been through it. I mean, my own journey, my personal journey has made me a better doctor, and it gave me a better understanding of the subject. Something, which both Ankita and I share. Anyway, let's get to some question. First thing is about food and breast milk. Now, this is a very, very common thing. And here in Kolkata, the Bengali community, they somehow have this, I would like to call it a myth at this point. They have this that if they eat spicy food, sour stuff, something katta, then the baby is going to get acidity. So what would you like to comment on this? Does the breast composition of the breast milk change with the kind of food that a mother has? Or does this composition, change in composition, does it affect the child? I mean, what do you think? What does science say?
So, like what you're saying, in India, I would say not just Bengalis, but across India, the Japa period, which is defined as a 6 weeks postpartum period, where the mother is in confinement and she's supposed to exclusively breastfeed her child, and this is a time which the mother is supposed to bond with the child. Our society, our family kind of imposes this thing on us that we need to have bland and tasteless kind of food and avoid sour things and avoid spicy food because it will give the baby acidity and all of that.
Yeah.
So I too feel that this is a myth. Scientifically, there's no proof to this, because a baby can develop food sensitivity whether the food is sour or not, or whether the food is spicy or not. In fact, the baby has already been exposed to the mother's normal diet in the womb itself. So there's no reason for the mother to change her diet even post-delivery. If, of course, if there's a food sensitivity, she can practice trial and error and remove, if she feels that the baby is too fussy after she eats something, she can remove that, she can eliminate that from her diet. But before that happens, there's really no need for her to do that.
I personally tell my patients that when you're breastfeeding, that is in the, we technically call it a puerperial period.
Right.
Puerperium. So, and that is also known as the 4th trimester, which means that after delivery, the next 3 months, that is called the 4th trimester. And during this puerperial, I kind of insist that my patients eat only home-cooked food. The only reason for this is that in home-cooked food, what happens is you're aware of what ingredients you're using. But if you eat food from outside, you are more prone to have some kind of a gastrointestinal infection or some acidity problems or indigestion. And, the mother might feel sick. The mother might not be, able to look after her child. So this is something that I almost insist that when you have a small baby and during your puerperium, avoid eating outside and try to eat home cooked food.
I think that's a general practice which we all should follow, that we
True.
should avoid having packaged food. We should avoid having outside food. Fresh food is always better.
Yeah. Eating fresh is, I think, the main thing that I would like to say. And I mean, quite in line with the food part. Do you think there is a myth that exercise affects the taste of milk? What do you want to say to that?
So when you exercise, you sweat. So if the mother breastfeeds her child immediately after exercising, there's a chance that the sweat goes into the baby's mouth, and sweat is salty to taste. So that is one thing. But otherwise, people feel that exercising does affect the taste of breast milk. Well, that's because there's a release of lactic acid into the breast milk when there is intense exercise done by the mother. But that lactic acid is released very, very quickly. So, and even otherwise, it's research has shown that babies don't really get affected with the taste, and it has no negative connotation towards the baby. So there's absolutely no harm, and there's no negative taste.
So this is a complete myth that exercise affects the taste of milk. There's no change in the taste of milk if a mother is exercising. The next question that we had, actually, we had sent mails to quite a few of our patients, encouraging them to ask questions, because that is when the women get talking, and that sort of, how should I put it, that sort of symbolizes Nari Katha. So the questions that we have, I'm going to take them one by one. The next question is, to be able to breastfeed unless you do it immediately post-birth, which means that suppose, in West, I've seen that the baby is born normally, and with the cord intact only, they put the baby to the breast and allow the baby to suckle, and the breast milk, that is supposed to be the first stimulus to the mammary gland that the baby has arrived and the milk needs to come. So suppose this is not possible, or this is not done, or the mother is very, very ill after her delivery with maybe infected stitches or a lot of pain in her stitches, or maybe the baby is sick and is in the NICU and comes to the mother 7 days later. I mean, does it cause problems if you don't allow the baby to latch immediately after delivery?
See, I think the best case scenario is if the baby is introduced to the breast immediately after birth, because the kind of alertness that the baby has and all the senses are completely in motion within 1 hour postpartum. So that is the ideal time when the baby should be introduced. But having said that, that doesn't mean that a woman does not have a fair chance to having an extremely fulfilling breastfeeding relationship, even if the baby is, for example, in the NICU, or for any reason the mother is unable to breastfeed the infant immediately after birth. Ideally, the infant should be introduced to the breast as soon as possible to establish that relationship. But there is I see women every day who have delivered and who are the babies introduced to the breast sometimes after 24 hours, sometimes after 36 hours, and they boast of having an extremely wonderful breastfeeding relationship with their infants for sometimes 2 years.
True.
So
actually, let me explain it. I mean, there's a medical explanation to it. Suckling is a very, very natural reflex.
Right.
And babies are born with that reflex. And you can make it out if you bring your finger to the angle of the mouth of a baby. The baby immediately will turn towards the angle and would like to suckle it. So suckling is something, it's a reflex which God has given to the baby while the baby is born. So it definitely, I will not discourage latching the baby immediately after the baby is born, even when the surgery is on. I'm not going to discourage that. But if you have not done that, doesn't mean that you will not be able to breastfeed.
Absolutely.
So the baby will be able to latch and will be able to suckle. When it comes to latching, I think there's a lot of misconception. People just put the nipple in the mouth of the baby.
Right.
So I'm sure you have a word or two to say in this. That should we put just the nipple or something more?
So if you put just the nipple into the baby's mouth, what's going to happen is that the baby will not be able to suck out the milk in an efficient manner.
True.
Ideally, the major portion of the areola also needs to go into the baby's mouth so that the suck is efficient and all the milk releasing pores are activated and the baby is able to suck the milk out. Because if the latch is not properly established, it puts the mother at risk of having cracked and bleeding nipples.
Yeah.
And breastfeeding is like a long journey, so it's not worth it. It's better to work on the latch right at the start.
So it's not only the nipple, because the nipple has the final terminal end of the ducts.
Right.
But the major portion of the duct is in the areola region.
Right.
So the areola along with the nipple should get into the...
Yes, exactly.
So then the lips will provide pressure on the areola and that will, bring the milk closer to the nipple and then out into the baby's mouth.
Absolutely. Yeah.
So that is the way. So this is latching is something which is taught, and that is why Ankita is here, and she's very kind. She will go to the hospital, teach the mother right at the bedside how to do this latching and how to take it forward, because latching is something, which is very, very important. Another thing is, most of us are right-handed, so we always tend to take the baby like this.
Yes.
So always the left breast gets priority.
Right.
So what would you like to tell patients? I mean, how to do both sides?
So I think immediately after you give birth, rather than, especially for first-time mothers, rather than holding the baby in a complex manner, hold the baby where you are comfortable. Ideally, the side at which you're feeding, you should support the baby's head from that side, because at this point of time, the head and the neck are a little bit delicate. So it gives you easier access towards, you're able to bring the baby towards your breast in an easier manner. Also, your free hand can maneuver your breast. So in case you're having some issue getting the baby to latch, you can always kind of give massage your breast a little bit, or assist the baby in pushing the nipple and the areola inside the baby's mouth.
Yeah.
So, and there's no hard or fast rule as to how you're supposed to hold the baby or how you're supposed to kind of position yourself. You should just be comfortable. Yeah. And if you fed from one side, you should always alternate.
Go to the other side, and then the left comes more naturally to right-handed mothers, but then you should alternate.
Exactly.
And here I would like to say that when you're feeding from one breast, there's a letting down of milk from the other breast too. So that's absolutely normal. There's nothing wrong in it. It's perfectly normal. And the next thing is, one thing I've noticed, that a lot of young mothers who've been breastfeeding, they complain of backache.
Yes.
And I think you explain why they get the backache and what is the way out and how to avoid this backache.
Unfortunately, women forget that the babies are movable, but their breasts are not. So they tend to bring the breast towards the baby rather than bringing the baby towards the breast. So ideally,
that is the main thing.
Exactly. Ideally, the mother should position herself comfortably and then place the baby on her breast rather than trying to maneuver her breast into the baby's mouth. And and especially another thing I've noticed is when a mother manages to get a latch, she doesn't want to change her position because she's too scared that if she breaks the latch, the baby will not be able to reattach itself.
Yeah. Or the baby will get angry and start bawling.
Yes.
Yeah. So the main thing is, please sit straight and lift the baby up. If necessary, put the baby on a pillow. Keep a pillow on your lap. Put the baby on the pillow and bring the baby to the breast's level rather than stooping down or bending down and trying to put the breast into the baby's mouth. Exactly. So this is something which is very, very important, and the right posture is needed, because Ankita kept on telling that it's a long journey and you have to do it for a long period of time. Another thing is position wise. Would you like to tell them that it's not okay to lie down and breastfeed?
Well, you need to be comfortable when you're breastfeeding. It's absolutely fine if you want to lie down and breastfeed. So you can lie sideways and make the baby face towards your breast, and bring the baby towards your breast again.
Oh, are there more chances of choking if you lie down and breastfeed?
Not at all.
Okay.
If you have proper assistance, if you are comfortable doing so, there should not be any problem. Make sure the baby is also lying sideways rather than lying on her back.
Yeah. Very nice. So next question we have is, you should not breastfeed if you are sick, which means that if the mother is sick, should she continue with her breastfeeding? Should she not?
She should absolutely continue with breastfeeding, because if, for example, if the mother has the flu or she's down with fever or a cold, she is producing antibodies to fight off the infection, and these antibodies she's passing into her breast milk. So when the infant is feeding, the antibodies are getting passed on to the infant. So this gives the infant the immunity to fight against that particular infection.
So this is very, very important. Someone has asked that breastfed babies are more clingy to their mothers.
This is definitely a myth, because babies are individuals. So every baby is different. Every baby's need is different. So there is, in fact, research suggests that babies who are breastfed and who've had a successful breastfeeding relationship tend to be more independent in the future. So even,
okay. I didn't know this. Excellent.
So even a baby who's not breastfed, you can argue and say that maybe the baby is facing separation anxiety, so the baby is very clingy. Babies, if they need emotional support, they will be clingy.
Okay. Yeah. No, breastfeeding does not increase the clinginess of a baby.
Ideally, you should exclusively breastfeed your baby for 6 months. That means nothing apart from breastfeeding.
Nothing apart, not even water.
Yes, and after 6 months, after you start introducing food, you continue breastfeeding for up to 2 years at least. That is the ideal time that you should breastfeed.
Any tips on weaning? I think they'll be really handy for mothers who want to wean out.
So weaning needs to be systematic, and mothers need to be very, very patient while weaning their babies. Please don't rush into weaning, because that will make it difficult for you as well as the baby. Take it slow, take it one day at a time, and start by doing small things, by reducing the time period for which you are feeding.
True.
Reducing, say, for example, distract the child in the afternoon if the child wants to nurse. And definitely continue with the night feed, because it's at night when the baby feels most insecure and they need that emotional comfort. So do it slowly and gradually. It will be a lot more comfortable. Don't rush.
Don't rush. Yes. So pain. She probably has a cracked nipple, or
probably if there is a cracked nipple, then there's a latching issue. Most likely, that's the most common problem that mothers face. If there's an issue with the latch, then generally there is pain in the nipple. Otherwise, pain during breastfeeding is not considered normal. It's supposed to be a comfortable experience for the mother and the baby. So if one is experiencing pain, I suggest that you detach and you reattach and you work on your latch.
Okay. I think my right nipple was not out properly. So, inverted nipple is a big issue. I think I would like to answer this question. Inverted nipple. Now, during pregnancy, the care of the breast, it should not start when you have delivered the baby. The care of the breast should start when you're pregnant. So during pregnancy, the breast also undergoes a few changes. It increases in size. Then there is pigmentation. Then sometimes about 4-5 months onwards, there could be a little secretion also coming out from the nipple, which is actually good and it's absolutely normal. So, but this is the time that we doctors, during the antenatal checkup, we are supposed to check the breasts and even the patient can check her own breasts, and both the nipples, they may not be same. There are nipples which are inverted. So one nipple may be out and the other may be inverted. Now these inverted nipples, they cause a lot of problem during breastfeeding, and they are the ones, which are more prone to get cracked, and the milk also, does not come out properly, and there's a lot of issues. Now this is something which a doctor or a nurse or someone like Ankita, who's an educator. So where were we? What were we talking about? We were talking about cracked nipples.
Yes.
Yeah. So cracked nipples is something, which is very, very painful. And not only painful, it can also be risky, because through this crack, the germs, they may go up the duct and lead to an inflammation of the breast tissue, which is known as mastitis. And sometimes this mastitis may become very, very nasty, and it can lead to pus formation inside the breast, which is known as a breast abscess. Abscess mane foda, breast abscess. Okay? And breast abscess is a very notorious thing, because the breast tissue is not only soft, it has planes which like spread on the tissue, and the breast abscess, once the pus starts forming, it really forms pockets very fast and involves the whole of the breast. And in that case, surgery and drainage, I mean cutting, incision and drainage probably is the only answer left. And it leaves a big cavity in the breast which needs daily dressing, and it can really be very, very painful. So a point or two of caution: cracked nipples, please consult your doctor immediately and try to rectify or treat them. And number two is, don't leave engorged breasts at all. If you feel the pain and the tingling, saying that মানে দুধ জমে যাচ্ছে, যদি এরকম যদি feeling হয়, if there is engorgement in the breast, then please pump out or manually express the milk out. Because if this milk stays inside, then that is really a culture medium for bacteria, and that is. What do you want to say to that?
So babies, the only way they can communicate is by crying. So babies would cry even if they need a diaper change, or if they're uncomfortable, or if they need to be held. It's not necessary that they are hungry. And crying is a late sign of hunger. So ideally, we should try and feed the baby before the baby starts to cry. Because why should we put the baby through that trauma? You should bring the baby to the breast once you see that the child is getting alert, or once,
The amount you make. Is that
Right.
true? Is that true? How much of milk does a lady make?
It's impossible really to kind of understand how much a lady is.
It's magical. It's completely magical.
Totally. It's the response to the baby that she has given birth to the amount the baby is suckling at the breast. That's the amount the mother is actually making. So it's very difficult to say that the amount you're pumping is actually the amount you're making. And plus, a pump is an imitation device. It aims to imitate the suck of an infant. So it cannot be 100%.
True.
So the most efficient way to remove milk from the breast, I would say, would be the infant. And the only way...
And the baby will just take whatever the baby wants.
Exactly.
And what the baby wants, the nature will provide.
Totally.
So it really works like that. It really works like that. And do you suggest some extra food or something, to increase the production of milk?
Firstly,
there are a lot of traditional foods which people have. We are going to talk about all of them. So do you suggest something like that?
I suggest
for increased production.
Apart from having a balanced diet and lots of fluids, mothers can have mango is supposed to increase lactation.
Okay.
Oats, milk and milk products, papaya, raw papaya especially, nuts. And they say Italian herbs kind of dry up the milk, like oregano and parsley. So you can avoid these things.
So
coconut is another thing which increases milk.
Okay, coconut increases milk. What about gond ke laddu?
Gond, yes.
They're so tasty.
Oh yeah. Gond definitely does help. Even soft does. But too much of gond is also not good. In balanced quantities, and too much of fat is also not good. It's just going to make you fat. It's not going to make you make extra milk.
Okay. So here I think I will just pitch in with a few medical facts. When a woman is lactating, she needs about 500 calories extra than what she needs. So normally if it is 2000 kilocalories per day requirement, energy requirement, during lactational period, it is straight away 2500, which just means that she should eat some extra food. Now, this extra food is very, very traditional according to communities. Like in your community, they will feed you halwa and gond ke laddu and doodh and stuff like that. In my community, in Bengali community, they feed you with a lot of fish curry, rice, and we say something like doodh shabu. Doodh shabu is milk and sago. So that, they make in a glass, and they make you feed 2 glasses of milk and sago. So the main thing is that these provide you with the extra calories that you need during lactation. And definitely there are some food items, they are called galactogogues, which means that they increase the milk secretion.
Right.
So all the traditional methods. So I tell my patients that you talk to your mothers. Mothers are the best teachers in this period. And definitely if the mothers are not enough, then, they can come to us. So a traditional way of handling a puerperium is definitely not a wrong way. It's a very, very correct way. You need to wait to breastfeed after pumping. Is that right? I mean, you've pumped the milk.
Right.
And then after that, do you need to wait?
Like we spoke, pumping doesn't remove all the milk.
Yeah.
So there's always milk left over. So it's absolutely fine to take the baby to the breast even after you've just finished pumping. There's no problem with that.
Yeah. So there you are. And suppose one is not leaking and one is not leaked during pregnancy in the 4th or the 5th month. So no leaking, does it mean that she will not have breast milk? Something like that?
Not necessarily, because that just means that the mother's body has realized how much milk needs to be produced, and when the baby asks for it, the mother tends to have a milk letdown.
Yeah.
So there's no leakage apart from that. That's just because the body is better adjusted.
Yeah.
I would say it's a good thing.
So in a nutshell, if you have to tell a mother, say what are the things that the mother needs to do to take care of her breasts, then what would you say?
I would just say keep yourself clean.
Yeah. Personal hygiene.
Absolutely.
That's definitely point number 1.
Yes.
So have a regular shower every day with a soap.
Yes.
And any soap you may use, not necessarily it has to be a medicated one. So any soap, a regular shower, then.
And please don't apply anything on your nipples. No ointment without asking your doctor.
Yeah. And even if the doctor has said to apply an ointment with a wet cotton swab, please wipe it off before you put the nipple again onto your baby's mouth. So you can have cotton swabs, wet cotton swabs. So wipe it 2 to 3 times and then make your baby latch. So this is something, yeah.
Yes.
And what about support garments? Wearing a bra?
You get nursing bras in the market. And I would suggest to wear a lightly padded nursing bra.
Yeah.
Because that gives you enough support, because at this point of time you need to take extra care. And it's more convenient for the mother to just just snap it open and then feed the baby and then place it back in place.
Yeah. So wear a light, nowadays very good nursing bras are available in the market. And because the nursing bra, it provides a support and it's also very convenient. And you were saying something very nice the other day when we met. You said about the pad that, if the bra gets wet with milk and that acts as a nidus for infection.
Right, exactly.
And yeah, so that is also very, very important. There should be a pad to soak up so that you're dry and your nipples are not so wet, because if they are wet, then you're very, very prone to get a yeast infection there.
Also keep
and it might
changing
get
the pad.
itchy. Yeah, just keep changing the pad. You'll feel very good, very dry, and the baby will be happy. The mother is happy. Wearing a bra, I think, is very, very important.
Very, yes.
So I think that was a answer to Divya Malik, and it was very, very nice, Ankita, having you on this Nari Katha episode. And
Thank you so
if
much.
there are questions, please feel free to ask your questions on this link. And once we have a set of, say, about 10 to 15 questions, we can again come back with another episode of Nari Katha, in which we will break all the myths of breastfeeding and really make breastfeeding the norm, rather than something, which is very, very, I really don't know what to say. Breastfeeding is absolutely natural, and it is a must between a baby and a mother. And only for those unfortunate mothers who fail to lactate, there is a small percentage of mothers who really fail to lactate. For them only the top feed has come. So we have to remember this. Top feed is nothing which is a matter of convenience. It is for mothers who fail to lactate. Thank you very much.
Thank you.